Hi, this is Brandon Todd, and welcome to my presentation on 6 things your Medicare Advantage salesperson doesn't want you to know or think about. We have an epidemic in this country, and our government has been cracking down on unlawful sales of Medicare Advantage plans. So this is a tool for you to use to look and see if your Medicare Advantage salesperson told you everything that he was supposed to, if you know if this was being disclosed, or if you're considering purchasing a Medicare Advantage plan, to make sure that this salesperson lets you know all of these things. So here is the 6 things. First of all, once you enroll in a Medicare Advantage HMO or fee-for-service plan, you no longer have health coverage through Medicare. Now, you're still in the Medicare system. However, you are disenrolled from Medicare Parts A and B. Medicare will pay the insurance company a pre-negotiated monthly payment for as long as you're enrolled in that plan. In most cases, you'll also have to pay a small premium to the insurance company yourself. Now, Medicare Advantage salespeople normally market Medicare Advantage plans to you by comparing their smaller premium to the often higher premium of Medicare Supplement Plan F. Yet, this is not an apples-to-apples comparison. The premium is less, so is the coverage. For example, Medicare Supplement Plan F, along with Medicare Parts A and B, can provide 100% coverage for all Medicare Approved doctor and hospital expenses. However, Medicare Advantage plans have co-payments and deductibles in addition to their monthly premium. Medicare has regulated that Medicare Advantage plans be the equivalent of the Medicare plan, not Medicare plus Medicare Supplement insurance. So this is not an apples-to-apples comparison, and it's not whether you buy Medicare Supplement insurance or you buy a Medicare Advantage plan. As a matter of fact, I'd rather you stay on Medicare by itself and be able to have the freedom to choose any doctor, any hospital, anywhere in the country, and without a Medicare Supplement plan, than go on something and not be able to get the healthcare options that you need at a later point. So Medicare Advantage coverage gaps can include simple doctor's visits, skilled nursing care, hospital visits, and emergency room care. Many seniors enroll in Medicare Advantage plans in order to receive the prescription drug coverage unnecessarily. Prescription drug coverage is available to you without restricting your access to healthcare options through Medicare Part D. And fourth, often people sign up for a plan because it is Medicare approved without knowing they're signing up for an HMO, a PPO, or a restrictive fee-for-service plan. And when I say restrictive fee-for-service plan, I mean that fee-for-service plan is limited to the physicians and hospitals that choose to accept that plan. And I'm hearing stories every day of how people sign up for a restrictive Medicare Advantage plan, and when their doctor says that they did accept it, only to, when they went into that doctor's office months down the road, to find out the doctor was tired of the laborious administrative processes that the insurance company put on him and quit accepting that plan, leaving people stuck in this Medicare Advantage plan for the rest of the year without being able to change, and having to either go find another doctor that accepts the plan and leave the doctor that they've been going to for years and years, or pay 100% of the fees for that doctor out of pocket, which is not a situation you want to be in. This takes away the patient's right to choose your own doctor, hospital, or specialist. You're restricted to doctors and hospitals that are in the insurance company's network. That's, of course, in the case of HMOs and PPOs. In the case of fee-for-service plans, there's no network, but many doctors not accept the plan because of long delays in payments and complicated claims procedures. I can't stress that enough, how big of a hassle these plans are for doctors' offices. In the case of fee-for-service plans, there's no network to choose from, but as I said, many doctors may not accept the plan because of long delays in payments and complicated claims procedures. HMOs also force a patient's doctor to work within the complicated administrative processes just to get their patient the care they need. If you're on an HMO, you must go to your primary care physician and get a referral before you can go to a specialist. And that physician is only allowed to give referrals based on the company's restrictions and guidelines for how that HMO can work. So, instead of going with Medicare Part A and B and good Medicare Supplement insurance, where you can go to any doctor, any hospital, anywhere in the country, you have to live by the insurance company's rules, which can mean serious consequences to your health. Even the physicians have limited choices. Now, this next headline, I want you to read it carefully because I want you to understand this. How can Medicare Advantage plans kill you? Imagine for a moment that a dreaded day comes that you're diagnosed with cancer, and we all hope that this doesn't happen. You, of course, would want to go to a cancer treatment center that boasts a lot higher success rate than the local hospitals. That center may not be in the insurance company's network. Therefore, you'd be forced to accept treatment at a local hospital that does not specialize in such treatment. Statistically, you will run a lot higher risk of dying from your cancer than if you had kept Medicare coverage that would allow you to get the best care possible. So with Medicare, you have been able to go to that treatment center of your choice, and your chances of survival would have increased. But what's worse, since you're on a Medicare Advantage plan, you've now opted out of Medicare, so you can't even fall back on Medicare coverage if you wish to choose your own treatment facility. You'll have to pay 100% of the cost as if you had no insurance whatsoever. But what will most people do? They'll just go ahead and accept the treatment, substandard treatment, at a local facility rather than seeking out the best care possible. And statistically, you're going to run a lot higher chance of dying preventably. So let me ask you a question. Why have you been paying into Medicare all of these years? The bottom line is that the choice of health insurance that you make determines the type of treatment you will receive when the time comes that you need treatment. Often making the wrong choices now could mean the difference between life and death later, and it can certainly make a difference in your quality of life and longevity. When you look back on all the tax dollars that you paid over your lifetime so that you could have good health insurance during your golden years, why would you throw your choices away just to try to save a few dollars? Would you do this when the odds of you needing quality health care are the highest they've ever been? Because right now, no matter how old you are, you're older than you were before. And the older you are, the chances of you needing high quality health care are increased. So right now, your chances of needing health care are the highest they've ever been. So why would you throw away your options at this point when you've been paying these tax dollars all your life in order to get Medicare coverage at this point? And thank you for listening to my presentation on the 6 things your Medicare Advantage salesperson doesn't want you to know or think about. I hope this has been helpful. My name is Brandon Todd. Please visit me, my Medicare Supplement Specialist, at medigap360.com, and we'll talk to you soon.